we'll start revising what we have already talked about in summary. So there is a stressful stimulus making damage in some part of the body. What's happening? There is secretion of chemical mediators, and these mediators, either on a local or a systemic level, organize the inflammatory reaction, meaning that inflammatory cells known as white blood cells, as they circulate in the blood, take a message to enter the circulation from the bone marrow. That's why we have leukocytosis. In the majority of inflammation, neutrophils predominate, because these are the first cells which take the message. And they go to the area where the damage has been made, and they leave the lumen and go to the tissues. Neutrophils do that first. Then we have macrophages. And if the inflammation persists, we have lymphocytes and plasma cells. Plasma cells are the cells of chronic inflammation. Neutrophils are the cells of acute inflammation, and they have a lobulated nuclei. So, apart from white blood cells, other elements of blood enter the tissues, such as plasma. That's why inflammatory areas are swollen. There is edema due to inflammation. And some molecules which can also leave the lumen and enter the tissues. One of them has a clinical significance, and this is fibrinogen, which, when it leaves the lumen and enters the tissues, is polymerized into fibrin strands. So, an exudate. What is an exudate? What comes out of the vessels? That is very rich in fibrin. If the inflammation persists, we have adhesions, and these are clinically important. So, now, if we have an increased number of neutrophils, probably due to bacterial infection, some of them die from the toxins of the bacterium, and their enzymes reach the tissues. And what do? They liquefy them. This is liquefied necrosis due to an increased number of neutrophils. Clinically, this is called pus. Pus, purulent exudate. So, when pus is formed, it can either fill a pre-existing cavity, such as the gallbladder, the pleura. It fills the cavity, or it can form a cavity in a solid organ where there was no cavity before, and this is called an abscess, and this is organized with connective tissue. If the pus destroys a lining of a mucosa of skin, and we can no longer see the epithelium of a mucosa or skin. However, on the bottom of this destruction, we see the granulation tissue. That means the organization of the exudae with newly formed blood vessels, mixed inflammatory cells, either neutrophils with lobulated nuclei or mononuclear cells, macrophage lymphocytes, and fibroblasts, which are called from the macrophage to go there and proliferate. This is inflammatory granulation tissue, and this area is called an ulcer. If the destruction is superficial, it is called an erosion. Christos, problem. Yes. No signal. Make the connection again. Yes, but we have to find the slides. Here go again. So that's all you need to know. All right? Here we are. So, yes, please.
Yesterday you talked about the difference between the ulcer and the granuloma. And you say
what is a granuloma? The granuloma is a well-circumscribed accumulation of inflammatory elements. All right?
yes.
Granulation tissue is not well organized. It would be a granuloma if it were. It is diffuse. So, come here and have a look at the slide. Now, the exam starts, but I am the one who is being examined, not you, because I want to know if what I said is clear. So, come here, please. Come.
Can I ask?
No, you come here with me.
Can I ask something quickly?
Yes.
When you said that when the mucosa and the skin are distracted,
Is distracted, yes.
superficial, it's not an ulcer, but it is
Erosion. It's an erosion, yes. Now, come here.
They are next to you.
Of course, here, next to me, of course. Now, what's your name?
Haralambos.
Haralambos. Have a look here. We have a section of the stomach, all right? Now, let's have a look. Tell me, Haralambos, can you identify where the mucosa is? The mucosa. What is the mucosa made of? Epithelium. And as far as stomach is concerned, it's glandular epithelium. Where do you see glands? Here. Try. Let's make
Here.
here. Yes, of course. So with the mouse. All right.
I can't see.
I can't see it either.
This.
Where's? These are the glands. Yes, they're the gastric pits. Excellent, Haralambos. Next. Are you from Cyprus?
Yes.
You drive left. That's why drive right. You drive on the left, and there is a discordance between us, I think. But don't drive too fast. All right? Don't drive too fast.
Yeah.
Okay. Because when we're having a lesson, we must have fun. That's how you learn. All right? And this is most serious. I told you the difference. Looking serious and being serious. There's a big difference between these two conditions. Now, have a look, Haralambos, here. What can you see in this field? What can you see? Here is mucosa, all right? Here are the glands.
Yes.
Where is the... Here are the glands. I have a neck. Here are the glands, all right? Is there an area where there are no glands? Show me. Yes, show me, please, with the mouse. Do you see the mouse? All right. Yes.
Here.
Here. So let's go look and see what's there now. Yes, let's go here. Look. What cells are these? You see how... You see the cells? They are like dark dots. That means that they don't have enough cytoplasm. All right? So the nucleus is stained with hematoxylin. That's why they are dark. And now I want you to look at the difference between the nuclei. All right?
They are round.
What's this? Not Facebook, not now. Not now. Later. So have a look. Haralambos, have a look.
They are round.
At this, yes, have a look at this nucleus. You see this one?
Yes.
Does everybody see this?
Lobular.
This, it's lobular. So what cell is this? What inflammatory cell is this? Neutrophil. And have a look at this one.
That's round.
Round, so it's a mononuclear.
Yes.
Probably a lymphocyte. So in this area, the mucosa is distracted. All right? There is a distraction of the mucosa. And instead, we see an inflammatory infiltrate, an exudate, all right, which is very rich in neutrophils. So, who wants to come here and show me the neutrophils, please? Among the inflammatory cells. Try and pick some. Yes, come. But I think you also drive on the left.
I do.
Yeah, so be careful, but don't drive too fast.
I won't.
Because if you drive fast, the Facebook will come back. Drive too fast. No, it's okay. I have some slides for the lesson, but I prefer to have a contact on practical issues, and then we'll see the slides. So, show me some neutrophil. Yes, this one. Why did you say that? This is lobulated. Lobulated. This one as well.
Maybe this one.
Yes. This is a very nice one. You see, it's not round. There is a lobulation. Okay.
Are these different cells, or is it
probably
lobules of the same?
I'm not sure for every cell I see, okay. But this is a neutrophil. All right?
So is it also a bit darker than neutrophil?
All nuclei are stained by hematoxylin, so they appear dark. Okay. Some of them are too dark, and this is hyperchromasia. Okay. But we'll talk about this in another lesson. So this is the exudate. So now we leave the pus. No, why did you leave?
Oh, sorry.
We leave the pus. No, you come. Stay here. Stay here. Now, what is this area here? What are these? Who wants me who would like to identify these structures? Yes. Who wants to? Have a look here. What structures are these? These newly formed structures. They did not pre-exist there. They are newly. What structures are they? Yes, please. So these are new blood vessels, all right? We have the inflammatory cells, yes. And furthermore, we have some cells. Now, have a look. You see this one? This cell here? Yes. This is a fibroblast. How did you identify it? It's spindle. It's spindle-like. So, beneath the exudate of the destruction, we have newly formed blood vessels, mixed cells, inflammatory cells, either neutrophils and mononuclear cells, and fibroblasts. And the fibroblasts deposit, what is this? Collagen. What is this called? When we see it in a place where there is an organization of tissue after a stressful stimulus which has destroyed the lining, the mucosal lining. Yes, please. It will end as fibrosis. Now, it's not that old. It's not that old. So what's this? This is inflammatory granulation tissue. That's why we call this area an ulcer. Okay? So that's the ulcer. Did you understand what the ulcer is? Now, and when time passes, fibroblasts will deposit increased amounts of collagen, and a scar will be formed. You see now here? There are not so many cells,
Where do you think?
Because here, yes, there are some areas of matrix of collagen. So this is the natural history, because the natural history of inflammatory granulation tissue is its transformation to fibrous tissue.
How do we differentiate this from smooth muscle cells?
Smooth muscle cells should have more cytoplasm. They should appear more pink. Okay. They form bundles like this. But these are fibrous cells, fibroblasts, fibrocytes, all right?
But the nuclei are similar.
Yes, the nuclei are spindle. Yes, in all mesenchymal cells, neural cells, fibroblasts, muscle cells. So that's an ulcer. Okay. Now we'll pass to another. How do we move to the another slide? Have the other slide? Christos, I want to leave this. So that's the gastric ulcer. Next. Which one? This one?
No, like there is
Christos will find it. The next collection of virtual slides of inflammation. This will be your lab. But I want you to introduce you now to the lab, now that we've, not this one, inflammation, not this one. Where is inflammation? Here it is.
Exams.
Exams?
Exams, yes. That is the one.
Here we are. Here we are. Okay? All right. Now. No, that's... no, it's not the one. Only inflammation. Okay, let's have a look here. Now, let's have a look at this slide. So,
Sorry?
your name, please?
Andreas.
Andreas, thank you. Who is coming to discuss this slide? Who wants to come? Come. No problem. Come. What's your name?
James.
James. All right. Now tell me, James, can you identify this tissue here? Have a look. You see? Let's have a closer look. You see this tissue here? What is this? It's some sort of covering, epithelium. What type of epithelium is this? This is squamous epithelium. Does it keratinize? Do you see the keratin? So what is this?
Stratified squamous epithelium.
That's a stratified, keratinized squamous epithelium, and this is most probably what?
Skin.
Skin. Excellent. Now, we leave the skin. Do you see an area beneath the skin? That means in dermis, okay? That is more, the color, it's more stained than the other areas of the dermis. Can you show me with the mouse, please? There are two such areas. Two such areas. Yes.
Here.
Yes, let me see. It's something. Let's have a closer look. Let's have a closer look here. So what is this?
It's a blood vessel.
It's a blood vessel. Excellent. And these are sweat glands, skin appendages. All right. So that was normal. Other areas which are more darkly stained. Other areas.
Here.
Let me see. This one, yes, and another one, bigger one.
Right over here.
Right. So let's go have a look here. What are these areas here? Now have a look. There are all these dots, dark dots, you see? However, their configuration is round, circular. Okay. Now, can you identify these cells with all these that we've said? Have a look. What is this cell? Have a look here.
Mononuclear.
It's a not mononuclear, it's a neutrophil. Have a look at the lobulation. See here the lobulation? It's like having three nuclei. No, it's one nuclei, but it's lobulated. All right? So, identify as many neutrophils as you can and show me.
So
This could be, yes, this one, yes, all right. Here, yes, so many. However, there are some other cells which have a round nucleus. These are mononuclear cells, all right. So, what is this? And here is the foreign body. You see the foreign body here? Which caused all this accumulation, all this round accumulation of cells. And I want you to see where did this foreign body come from. If we are lucky enough to look at it. No. Here it is. This is an invagination of squamous epithelium, all right? And it has many structures in it. One of these structures has left and became here in the dermis. So it is recognized as a foreign body. That's what causes the inflammation. All right? So, how is this inflammation called, and why is it different from the previous inflammation?
This one here.
This one, yes. Have a look at the contour. This is a granuloma. All right? Why? Because we see inflammatory cells forming a round structure. And inside the granuloma, we can see the cause of the granuloma. It's a foreign body. Keratin. This is keratin. So now, let's have a look at the bigger one, granuloma. And inside this granuloma, we can actually see granulation tissue. You see here? It's granulation tissue. Newly formed blood vessels, mixed inflammatory cells, and possibly some fibroblasts. So, there are also some giant cells. These are macrophages which coalesce and make the giant cells. This is a giant cell. And there is a most interesting cell here. Have a look at this cell Here, have a look. This one, this one, this one, this one. Now tell me, let's try to identify these cells. The contour of the nucleus, is it lobular or round? Round. So this is a mononuclear cell, okay? Yes. Does it have enough cytoplasm or too little cytoplasm, such as mature lymphocytes? It has cytoplasm. Look, it has cytoplasm. However, this cytoplasm here is different from these mononuclear cells. You see, this mononuclear cell has some sort of bubbly cytoplasm. You see all these bubbles here? Why? Because this is a phagocyte, and it phagocytoses. So this is a macrophage. And in case it phagocytoses hemoglobulin, this appears as hemosiderin. This is hemosiderin. So these are macrophages or histiocytes, okay? The other cells here, mononuclear cells, but with cytoplasm of different kind, a bit amphophilic, and there is an eccentric localization of the nucleus. Which is this mononuclear cell? Which is neither a macrophage nor a mature, nor a lymphocyte that we cannot discriminate. This is a lymphocyte that we can tell if it is of B or T origin. So which is this cell? This is excellent. This is a plasmacyte, and this is the cell of chronic inflammation. And where do we see all this? We see all this in a granuloma. It is granulation tissue. Why do we call it a granuloma? Because it is round. Is that clear?
Yes.
Is this too difficult to understand? Yes, please.
So why do we have sometimes granulomas forming instead of just granular tissue?
Why are they formed? Granulomas should have distinct margins. Probably the organization of the region of inflammation leads to a rim of fibrous tissue which makes it as here, and it's not diffuse. I'm not sure what discriminates what will happen. If we'll have a diffuse inflammatory infiltrate, or if we have it as a granuloma. Perhaps you can look it up and tell me. Yes, please?
Can the granuloma be formed by infection, or it's only by foreign bodies?
Yes, that was the foreign body, all right? So let's have another type of granuloma now. How do we go back?
On the other tab.
This one?
Hit the X over here.
Here?
No, the X. Next to. Yeah, there.
This one?
Yeah, hit that.
Ah, all right, all right. Now have a look here. Let's have a look here. Can you identify this normal tissue from histology? What cells are these? Two dark staining with little amount of cytoplasm. Which cells are these? Excellent. These are lymphocytes. However, they form a structure. They are not diffuse. They form a structure, and similar structures are scattered throughout the body. Can you identify this structure? Excellent, lymph node. So thank you very much. Come here, please. This is a lymph node. And adjacent, we see some other tissue with some axini here and some ducts. All right, this is salivary gland. Now, let's have a look at this lymph node. Is there something different from the normal lymph node that we see here? What is the difference between this lymph node and the one we saw before? Can you tell me, what's your name?
Alkinos.
Alkinos, yes. Okay, tell me, please. What do you see in this node?
Can I use a mouse?
Of course.
I lost right away. I think it's the color different. We see some staining differences.
There are some staining differences. There are some structures of a different color.
Correct.
And what is this, the contour of these structures? Show me the contour with the mouse, with the arrow. Show me the contour, please. Yes, the contour. Have this structure here, like that.
Okay.
A bit lower magnification. Have a look here. This is the contour of the structure, all right?
Right.
What type of contour is this? How would you describe it? What shape?
It's round, but...
It's round,
yeah.
yes. Some structures merge with each other. However, their contour is round.
Okay.
So, if these are inflammatory cells, the cells that form these structures, how shall we call these structures? These are granulomas. However, they are different from the previous granulomas, because in the previous granulomas, the foreign body type, there were common cells. It was a granulation tissue with a round configuration, actually. Here, we have a special type of cell. And these are these cells. You see, they are where one cell ends and where the other cell starts, it's not so clear, because this is a specific type of cell which forms these granulomas, and these cells used to be macrophages, but now they no longer phagocytose. They are exclusively secretory cells. So these are epithelioid histiocytes. They used to be macrophages, and when granulomas are formed by such cells, epithelioid histiocytes, these are immune granulomas. And so we have to look at some specific causes. Most probably Mycobacterium of tuberculosis, sarcoidosis, and probably leprosy. So, another finding within some of these granulomas is what they have at their centers. How could you describe this area, Alkinus? How would you describe this area? Here are the histiocytes.
Right.
The epithelioid is. How would you describe this area here? Have a look at it. It's of a different structure.
Well,
how would you say?
Non-nucleated.
We don't see nuclei, yes. There is a material without any nuclei. So what could this be?
Some sort of secretion.
Yes, but since we have some very, very small parts, you see these small parts of nuclei, that means that nuclei have broken and we have the remnants of nuclei. So what's this area? What do you think? Anybody can tell me. What do you think? Yes, please.
It's collagen deposition.
One thought, because it stains with eosin, it's to be collagen. But collagen should form fibers. Fibers. This does not have such a structure. It's too homogeneous, I'd say. Let me remind you what eosin stains. It stains cellular cytoplasm, fibers, collagen fibers, and
necrotic tissue.
So this is necrosis. And this is cassation necrosis, and this is most probably due to tuberculosis or some fungal infection with fungi. They can make cassation necrosis. So this is a specific inflammation, tuberculosis, as far as this is concerned.
Can we zoom a little bit to see what it looks like closer, the necrotic?
Yes, the necrotic, yes, of course. Let's have a look at another lymph node. Oh, have a look. See how many the granulomas are? This is a granulomatous lymphadenitis, all right? Is it too difficult to discriminate the necrotic areas within the immune granulomas? Who can show me the necrotic areas in this magnification? Thank you very much. Who would like to come? Not you again. You drive too fast. Drive too fast. And on the left side, one who drives on the right side, please. Who drives on the right? Everybody drives on the left. Are you all from Australia and Cyprus? Nobody from America? Who is from America? Ah, you are from America. Problem here. Come. Where are you from?
Cyprus.
Cyprus, all right, come. What's your name, dear?
Stavrini.
Stavrini, come here. So, have the mouse, all right? Where is the area of necrosis in this magnification?
The lighter parts. So where
That's it. Here it is. Yes, this. Another area?
Here.
All right, all right. And let's go a bit closer. Let's go a bit closer now. Yes.
Well, I have a question.
Yes,
Why
please.
does the necrotic area though look lighter when it's stained with hematoxin and eosinophil?
It's pink, but an amorphous pink color. Neither cells, cytoplasm of cells, nor fibers. And I'm looking for another feature of tuberculosis, not so specific, but often observed. What can this be here? You see, this is a cell with many nuclei. However, it's not the typical cell of tuberculosis. We'll have to study the slide throughout and see if we have Langerhans giant cells, as we saw them in the slide the other day. Are there any such cells? Let's have a look and see if we can pick one of them. No, not here. All right, perhaps we'll have a closer look. So if we see this sort of granulomatous lymphadenitis, we must have a specific stain. That means, what's the stain called? Gill-Nielsen histochemical stain, and it will highlight the mycobacteria of tuberculosis, and this is how the diagnosis will be confirmed, and the patient will have the proper treatment for this infectious disease. All right? Okay. Any questions here, please? Because we have some clinical scenarios to discuss, and we'll finish our lesson this way.
Professor, can I ask something?
Just tell me, please.
In the granuloma, only the very pink area is the necrotic one?
The very big, the amorphous, yes. The others are the hypothelioid histiocytes, which form the granuloma, the immune granuloma. We'll play the Joker. Play the Joker game. How many money is it? How much money is the Joker? 2 million, 3 million. We found the Langerhans cell giant type. Who can show me the Langerhans cells? Not you, Stavrini. Who can show me where the Langerhans cell is? You're too far away. Who can show me it is a cell with many nuclei that form a rim. One cell, let me help you. Because if he finds it, I'll take him and play the game then. So where is the Langerhans cell? With the nuclei forming a ring. Come. Yes, you come again.
He raised his hand, he didn't come.
He didn't come. Anybody? Yes, come please. Yes.
The big one.
Yes. The big one, yes, but I want you to show me, because if I show everything and I'm the only one who talks, I am the only one who shows the slides, with the mouse please, then we'll go to sleep. And when we have a lesson, we should not feel like going to sleep. That's another part of the hospital where somebody who has disorders of sleep goes, and it has in a room like this, not too much light, and he attends a lecture, and 5 minutes then, 10 minutes, and you go to sleep. Sometimes. Gradually you go. No, that's not what we do here. Not what we do. It's not our way. Yes. Show it again.
Is it this one?
This one, yes, that's the Langerhans cells. All right, now, let's have a look at some slides and finish our lesson today. Now, that's number 15.
Professor,
Yes, please.
so the lung cancer cells are from macrophages which combine together?
Yes, and this, listen, when macrophages coalesce and form a giant cell, multinucleated giant cell, we identified it of Langerhans type if the nuclei form a rim. If the nuclei are dispersed throughout the cytoplasm, it's a foreign body type giant cell. However, these cells are of the same origin. The one that is of the Langerhans type is in a later stage of organization of its organelles, and it's more consistent with tuberculosis. However, in tuberculosis, we can have giant cells with dispersely distributed nuclei. So it's not necessary to have the Langerhans cell type for tuberculosis. It is also not necessary to have caseation necrosis, because all tuberculous granulomas do not have necrosis. But when we see necrosis, that's what we think. Now, yes, please.
The Langerhans cells become epithelial?
Langerhans cells. No, epithelioid cells are histiocytes that form the granuloma. You ask me if these are the cells which form the Langerhans cell, giant cell. I'm not sure. I'm not sure. All right? So, let's have a look at this inflammatory cell population. So, we have 1 week after a deep puncture wound to his forearm, a 40-year-old man develops local pain, erythema. Erythema means it becomes red. Why? Why do inflammatory regions that we can see either on the skin or in a mucosa appear red? Why? Who can explain that? Because, yes, please.
Because of increased blood flow.
Increased blood flow. Because we have the stressful stimulus which starts the inflammation, and more blood goes to the area to take the white blood cells, send them outside the lumen of the vessel, and so they start their function in order to eliminate the inflammatory agent. So we have the phagocytic cells here. What are these cells? Please identify them. This one.
We can't see them now.
I cannot show. I'll show them with the pointer. Because we have a mixed inflammatory cell population here. All right? Is that water for me? It's a glass of water. Should I drink it? The water. Is it for me? It's full. I'll drink it. No problem. It's very yes. All right. Great. When I buy coffee, I have my colleagues and they drink their coffee. I'll take their coffee and drink it. Like, when I find coffee, I'll take it and drink it. Okay? Very good. Now, what cells are these? Who want to identify these cells? How can you discriminate these nuclei? This one, here, this one? Is there somebody who cannot identify these cells as neutrophils? If he cannot identify it, there's no problem. He'll call me and I'll give private lessons. But the private lessons will be free. No. Okay? Private. Free! I'll give them free. I practice medicine as a hobby, as you understand. That's my hobby, not my profession. It's a hobby. So I don't need to get paid for it. It will be free. If somebody does not understand something, all right, and feels not safe enough, I'll give him a private lesson, okay? So these are neutrophils, all right? Yes. Now, what are these cells? Have a look at this one. And this, and this. These are mononuclear cells with enough cytoplasm. You see the cytoplasm? So remember, do you remember the cytoplasm of the plasma cell? It was amphiphilic. This is not like that. This is a cytoplasm of a cell with phagocytosis. So what are these?
I was going to say macrophages.
Macrophages, all right.
What do you mean amphiphilic?
Amphiphilic is between pink and purple. That is amphiphilic. It's neither pink, eosinophilic, nor purple, basophilic, hematoxylin staining with hematoxylin. All right.
This is basophilic.
This is light. It has a light pink color of the cytoplasm. The plasma cell cytoplasm is amphiphilic, somehow between pink and purple. Is somebody wearing something? No, don't have this color today. No. Okay.
Which kind of cell is it? The one next to the macrophage?
In the previous image?
Yes. Is that the giant cell?
This is,
No, to the left.
this one?
Yes.
No, it's not a giant cell. It's not a giant cell. It's a macrophage which has phagocytosed other inflammatory cells. Yes. Yes, I want to discuss this as well. This is a 56-year-old woman with rheumatic valvular disease, who has developed endocarditis after a dental procedure. Some bacteria entered the blood and went to the valve and caused inflammation. And what happened? This is endocarditis, all right? Inflammation in medicine most often has itis at the end of the term, endocarditis, okay? So, despite the use of antibiotics, she develops chest pain followed by hypotension and she dies. This is the gross appearance of her heart and pericardial sac at autopsy. After a removal of 350 millimeters of fibrinohemorrhagic and purulent fluid. So, can you see here the surface of the pericardium? What can this be? What sort of exudate, inflammatory exudate, because in addition to endocarditis, the patient developed pericarditis. Remember that in areas of the body that we have serosal surfaces, the exudate most often is rich in fibrin. And you see here, this is a fibrinous exudate. And why is this clinical important? Because if these areas are organized, they form adhesions, and between the two layers of the pericardium, the whole heart is entrapped and cannot work properly, okay? So this is fibrinous pericarditis, and this caused a fatal pericardial tamponade. That means the heart was entrapped and could not move, could not work. And that caused the death of the patient, okay? And we'll have the other presentation.
How quickly can that develop? Can it be?
It takes some days. It takes some days. Yes, it takes some days. It's not so acute. It takes some days. Now let's have a look here. This is the document with here. Now you have a trauma in the skin, and you have a look at the tissue that is formed beneath the cut, all right, under the cut. You see here? Oh, yes. Now, the best resolution. Okay. You see here? His right calf falling from the skateboard. Okay. This is 10 days later. Remember how this tissue is called and what it is composed of? What are these? These are newly formed blood vessels, and they are too thin-walled. That's why they can break easily and cause hemorrhage. If you look at this tissue with the eye, it will appear like a strawberry. You see the strawberry, that it has some granules? That's why it's called inflammatory granulation tissue. One part of the inflammatory granulation tissue are the blood vessels. The other part is the inflammatory infiltrate, these cells. And the other part are these cells here. You see the spindle cells? The fibroblasts. All right? So this is granulation tissue.
Professor,
Yes, please.
do we see red blood cells just floating in the tissue here?
Some thin-walled, newly formed vessels have.
So they are inside vessels. How do we know if they are inside vessels?
This is inside vessel. You see the contour of the lumen.
Of course. But
Here there is some sort of hemorrhage. They are dispersed.
they're dispersed.
Dispersed. Yes. Okay. This is theory. Yeah, just a moment. I want to show you. This is theory. I'm not so good. So you study it and you'll teach me the growth factors and what each one does. I do not know that very well. You'll study this because your brain, you're 20 years old. I'm 60. So you understand better than me. So what is my purpose here? To give you practical knowledge. That's what I am good at. Not to give you theoretical knowledge. That's not my field. I'm not capable for this. Okay? You study and then you'll teach me. But don't be too austere in my exam, because I'm a 60-year-old man. Shouldn't be. Not too strict. Friendly, in a friendly way. All right? Anyway, I'm not anxious. You've understood that. I do not have any sort of stress or that. No. You see all these pathways here. Is it for me to analyze the pathways? Here we go. What happened to the granulation tissue after the cut? We had the granulation tissue. There wasn't an infection superimposed on the area, because this would cause a recruitment of neutrophils. So the cut was clean, and what happened after a couple of weeks? Have a look. This used to be what I showed you previously, the inflammatory granulation tissue, but now it has formed a scar. It has formed fibrosis, and the upper part here, the skin, has re-epithelialized. So that's how the cuts are evoluting. Their evolution. They start with inflammatory granulation tissue. Up to a point, we have the newly formed blood vessels and the mixed inflammatory infiltrate. However, fibroblasts predominate after some point, and we have the deposition of collagen. In some cases, this deposition is extreme. So we have hypertrophic scars or keloids. How shall we treat these complications of fibrosis? These have to do with what inflammatory cells secrete. So we could make injections of immunosuppressive agents so that fibroblasts are no longer triggered to produce and deposit collagen. So what do we inject? Corticosteroids, all right, to control this fibrous tissue deposition.
Professor,
Yes, please.
how do we know that it's a scar and not a necrotic cassation?
There are viable cells in it. These cells here are fibrocytes. It's not a amorphous, homogeneous, pink staining tissue like necrosis, all right? This is a scar. When we see cells of connective tissue, we call them fibroblastic reaction. When we see only fibers, we call this fibrotic area or scirrhous tissue. So fibrosis means we have only fibers deposition, no longer cells. We have fibers. Desmoplastic reaction means that we can identify fibroblasts and fibrocytes. Okay? So, remember this, the adhesion, which forms when we have a fibrinous exudate? All right. So, we'll have you'll study the slides. Okay? Is there any question, please? Any question, please? Yes.
So, if we have many injuries, let's say on the skin, is there a point where it becomes a non-viable organ because of the main scarring? Or maybe to the liver? Or
if you mean some injuries are not caused by an exogenous factor, but they appear on their own?
No, I mean like when we have inflammation, the tissue that replaces the damaged tissue, let's say, is not the same as the tissue that pre-existed there, is it?
Yes.
So it's not functional.
In the edges of the trauma, we have some myofibroblasts which move, which can contract their cytoplasm, and this is the cause that some scars are asymmetrical. We do not have a complete coverage of the area. Yes, that's why in scars that are, the edges of the scar are too distant, we have to yes, and have the edges come together. Because if we leave them like this, it will come, the phenomenon will be the same, but we won't have a proper re-establishment of the area as it was before. Okay? Okay.